Before we begin, I would like to acknowledge the traditional custodians of the land on which we gather today, the Darug and the Eora nations. I pay my respects to their elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people here today. Welcome everybody to GMF Australia's presentation, Our Reflections from the Field. My name is Javed Sharif. I'm a co-founding member of GMF Australia and the Secretary of GMF Australia. Today's presentation will include a brief introduction, followed by 2 sessions, approximately 40 minutes each, with a small break in between. There will be a question and answer session at the end, and light refreshments will be served. A warning. Content in today's presentation may be distressing to some. There will be graphic descriptions, videos and photos. Discretion is required. We will give you plenty of notice and warning when we will be presenting these graphic imaging. We also request you to silence your mobile phones. GMF Australia started in 2013 over a dinner table. A few like-minded individuals joined together with the sole purpose of providing healthcare to the underprivileged people locally and internationally. We were initially part of Global Medical Foundation headed by Dr. Khalil Siddiqui from the US. In 2013, we created our own chapter called GMF Australia. We are a non-denominational group with no links to any religious or political organisation. Our main aim is to serve humanity. GMF Australia strongly believes that all funds raised through donations go directly to those who are in need. Our volunteers pay for their own transport and accommodation. The cost of today's presentation, the marketing you see, the video, the light refreshments you'll have today are all covered by us, not through your generous donations.
I'm a general practitioner.
I'm a cardiologist.
I'm a pharmacist.
I'm a general surgeon.
I'm a general and colorectal surgeon.
I'm a humanitarian volunteer for GMF Australia.
GMF Australia was established about 10 years back by a group of us with the pure intention of helping those who are in need.
We want to provide free healthcare to those who can't afford it, and we want to improve people's quality of life as best we can.
GMF Australia runs both local and international projects. Our local projects are feeding the homeless, a regular blood donation drive, and providing aid to the refugees who arrive in Australia. We've gone on medical and surgical missions to Africa, India, Nepal, Philippines, Bangladesh, and Jordan. We also facilitate cataract surgeries in Africa and in the subcontinent.
Each mission that we go on is very different, but the one thing that I do find common is the environment that we work in. The environment that we work in is not what we're used to here in Australia. The environment that we work in has no resources. The conditions are quite poor, there's no air conditioning, the surroundings are not very clean, yet patients are still there who need care.
There's just no resources at all for the patients. I can't imagine how they live there. The room just packed with patients. Like I feel suffocating, especially when the weather is very hot and all of us will be working from morning to the afternoon, non-stop. Although we could only spend like a few days there, see the smile on the patient's face that makes me feel that I've made a difference in the people's life.
Now, without further ado, I'd like to introduce Erica Long, a lawyer, a filmmaker, who will now interview Siraj and Sanjay regarding the Gaza mission.
And thank you for joining us today, Siraj and Sanjay. There's a lot to cover today, so let's get right into it. Going back to the start of your mission, you both left Sydney on the 12th of April and arrived in Cairo the following day. What did you do once you arrived in Cairo?
So we got into Cairo on a Saturday afternoon.
We were picked up by the Med Global team. Med Global was our project partners. They've been on. They were our people who were coordinating the mission for us. Med Global is a humanitarian organization based in the US, and we have done previous projects with them, and we have a good working relationship. So they help us procure supplies like food boxes and medical supplies, which we could take into Gaza. So we got to the hotel, we checked in, and we met the rest of the team, which was going to cross into Gaza on the Monday. So in the picture you see, that's a Raja on the right of your screen. So she is the director of coordination of organization missions in Gaza. So we had a couple of GPs, that is Jalal and me. We had a plastic surgeon, we had an orthopedic surgeon, Sanjay. There was a nurse who's not in this picture, and we had 3 security personnel with us.
And the following day, you actually had a briefing at the World Health Organization. Can you tell me about the briefing, Siraj?
So the following day was pretty full on. We were meant to be at the UN and the WHO meetings, which were quite comprehensive. We were briefed about the situation in Gaza. There was no access into the north of Gaza, which was completely isolated from the rest. There was only time they could go in was if there was somebody really sick and they had to be evacuated from the north. We were briefed about the security measures. There was a message which was loud and clear was that our safety was of utmost importance, and all coordinations had to be made with a couple of Israeli organizations called COGAT and the CLA. So every movement in Gaza from point A to point B had to be coordinated by taking permits from them, and after having green signals, you could move from point A to point B. And that was true for the local Gazans as well. They couldn't move. I mean, they were restricted because of these organizations who were there. We were meant to be moving or traveling in a clearly marked car. We were meant to be carrying satellite phones with us just in case our phones did not work. They also spoke to us about carrying a run bag, which was a bag in an event that we had to be evacuated. That's a bag you're going to carry and run, basically. So it was something which we had to have with us at all times, with a set of clothes, some food to last us for a couple of days, some medicines, water, and your passports. We also had a trauma kit in there in an event that we got hit or we got injured. There was supplies which we could use to keep us, give us for first aid, which we could use for ourselves. All cases where we saw had to be coordinated with the medical response team sitting in Italy. So every night we had to WhatsApp them the cases which we had seen, how many kids were injured, were there any particular diseases which were spreading. So we were briefed about all of this, and we met all the other organizations who were there, who were going to cross with us on Monday.
And just looking at the trauma kit that's actually on screen right now, one of the things that were in the trauma kit is actually a tourniquet. Can you talk about that and whether or not that's something that would ordinarily be included in one of your missions?
So tourniquet is one of those important things where you stop bleeding. So in an event that you get hit on your limbs and you have a gunshot injury or a blast injury and you're bleeding, you apply it to a limb proximal to where the injury is to stop the blood flow, to stop from bleeding out basically. So tourniquet is one of the most important things you'd carry in a trauma kit.
Okay, and going on to the following morning, Sanjay, can you tell us about how you got from Cairo and into Gaza?
So we needed to be packed and prepared at 3 a.m. So we had to load all our suitcases onto a van. There was 8 of us altogether.
And it took some time loading the van because we could only take in supplies into Gaza that looked like civilian supplies, so they had to be packed into suitcases. So we had about 40 suitcases altogether of the supplies that we'd gotten from Egypt, the supplies that we'd taken from Australia. We then travelled from Cairo up to the Gaza Strip, crossing the Suez Canal. It's about 550 kilometres, but the main delay is that you get stopped at multiple checkpoints. And I think there was about 4 or 5 checkpoints altogether where they take all our passports, they rigorously check who you are and why you're there. And part of that is because we have to cross the Suez Canal, which is one of the main income streams for Egypt, but also a big economical supply chain for the rest of the world. So it's very carefully guarded. We made our way in towards Gaza and ended up in Rafah. And the sad thing was that before we got to Rafah, for kilometres, there was aid trucks everywhere. They were lining up, and I counted almost 600 of them that were just sitting there waiting to get in, but not being let in.
Literally hundreds and hundreds of trucks, which are just sitting there, all fully laden with food and aid that just can't quite get through.
So it's quite sad to see, because on the other side of the wall that you see is people who are starving, and there's just food kilometres away. So we got to the Rafah crossing checkpoint, and unfortunately we spent almost about 6 to 7 hours there, where they made us unload our luggage, they looked through our 40 suitcases, they got screened. We could hear drones flying overhead, so there was a constant buzzing noise. It almost sounds like a lawnmower that's constantly over in the sky. We could hear gunshots in the distance. By the time we'd gotten through the border, had everything checked, it was approaching nighttime. And we were being told it's getting a bit concerning because we were strictly informed that we can't travel at night. So getting a little bit concerned, but by the time we got through, it was a very late evening and almost nighttime, and we had to take the risk to get back to our safe house.
And Siraj, once you got into Rafah, what was your first impression?
I was relieved that we were in. We had finally entered Gaza. So the first thing which caught my attention was this "I love Gaza" sign right outside the checkpoint. We had the sound of drones, like what Sanjay described. It was pretty loud. It was pretty obvious. You couldn't see these guys. You couldn't see these drones, but you could hear that constant buzzing, and it was quite loud. It was almost there was this call for evening prayer happening at the time. I could see a couple of people breaking fast, opening their fast. By the time we loaded all our luggage into the bus, it was quite dark. It was quite late. We traveled, from the time the distance from the checkpoint to the so-called safe house we were there in Rafah, it was about a 45-minute drive. So we passed through quite airy, dark streets. The only light you saw was from an occasional shop which had some light on. You'd see groups of people. The lights were from them using their mobile phones. We passed through a lot of tents, and in the night you couldn't actually determine the gravity of how many tents there were, but there were quite a few tents, quite closely packed. We reached the guest house. It was quite late that night. We had something to eat. And the rest of the night, we were unpacking our luggage and sorting things out for the next day. I remember quite a few bombs going off that night. Some were pretty close to where we were. We could feel the safe house shatter. We could hear the glasses would tremble. We fell asleep. We were again woken up early hours of the morning to sound of drones about 2:30, 3 o'clock in the morning. Again woken up to a lot of bombing which was happening around the area.
And you've actually prepared a short video showing what you saw. Could we please just play that now? tell me about the bombing that we heard at the very end of the video? Why were they firing into the water?
So I remember going, we were all pretty up early, so we went to the roof of the the safe house, and that was our first sight of Gaza by day. So there were lots of tents around the area where we were staying, lots of kids running around, and at a distance you could see a water tank which was with people huddled, people surrounding the van to collect water for the day, for cooking and the rest. At a distance, you could. So the story goes that if people were desperate for food, and there was no food, so there'd be all these fishermen going into the Mediterranean Sea to fish, and if they got anywhere where they shouldn't be, the Israeli Navy would fire gunshots at them. So what you're listening to in the video there is gunshots trying to warn fishermen to back off, basically.
And they were just trying to get food for their families.
They were just trying to get food for the families.
Moving on to the rest of your first week, you and Sanjay were actually split up and you were allocated to different hospitals. Sanjay, can you talk to me about where you were each allocated?
So the Gaza Strip is actually quite a narrow region of land. So it's about 40 kilometres long and it's only about 15 kilometres wide. Siraj was stationed in the southwestern corner in Rafah at the primary healthcare centre. I was stationed for the entire 2 weeks in the middle of Gaza at Al-Aqsa hospital, and that's the top arrow that you can see. And the plastic surgeon who came with us was at the European hospital, which is in the bottom right corner. Now, Gaza used to have about 30 hospitals, and by the time we'd gotten there was only 3 functioning hospitals left. And this was catering to 2.2 million people. So you can see the security personnel there coordinating the route that we have to take, the drives we have to take. As Siraj said, we can't leave until we're given the authority to leave, and we have to go at specific times. So you can't be late leaving and you can't get there late. There's always the risk that our security cannot be guaranteed. So although we go there on the expectation that these things are carefully monitored, there's no guarantee that we're not going to be held up with conflict. The house that we were staying is supposed to be deconflicted, which means that the Israelis know where we're staying, and for that reason, this house should not be targeted.
Turning now to where each of you were allocated, Siraj, let's turn to your experience first. You were posted at both the primary health centre and the nutrition centre in your first week. Can you tell us what the PHC is and what your experience there was like?
So PHC is a primary health center, and to give a comparison, it's like a very small medical center. What we would have here. So the PHC had a few rooms, a consultation room with just a table and a chair and an examination bed. So there was a very small treatment room, which people coming with lacerations and traumas got the sutures. And there was a couple of rooms at the back which could be used for people who are sick and who required cannulas and to give fluids. There was a dental unit at the back, there was a pharmacy, so everybody who came in through the primary health center got free treatment and they got free medicines. So to understand a bit of background on Rafah, Rafah had a population of 1.5 million internally displaced people at the time we were there. So people have been displaced from the north to the south, and some of the living standards, some of things which we saw and heard were really gut-wrenching. So on the screen you can see the tents which were very closely packed, and each tent had about 10 or 15 people, extended families living inside them. So for every so people were living in tents, people were living with makeshift schools. So the schools, classrooms were packed with people. There was garbage everywhere. There were, for every 10 to 15 tents, so about 100 to 150 people, there was 1 or 2 toilets. And the toilets were marked, one for men, a couple for men and a couple for women, clearly marked. And what we saw was stagnant water, garbage, kids playing around or kids walking around, picking up things from the garbage. You'd see kids old enough to hold a container to fill water. They would be there taking water, and this water would be brown. And this was supposed to be the clean water which they were collecting for the day. So as a result of that, what I saw in the primary health center was a lot of respiratory infections. So if you imagine, you just need one sick person to transmit the viruses. There was no sanitation, so we saw a lot of diarrhea. And imagine having diarrhea in a place where 150 people are using one toilet. There's no water, and people are having to wait in line to use the toilet. So there was about 20-25 minute wait per toilet for them to use this. You walk into Rafah, you get the stench of the garbage which was lying around for months and months. A lot of mosquitoes, to stagnant water, garbage. And also we saw kids with burns. So people were cooking inside the tents. And kids would drop water on themselves, boiling water on themselves, causing burns to the skin. We saw kids with horrific burns to the limbs and abdomen and chest, and all they got was Panadol and Nurofen for pain relief and some very basic dressing. We did see a lot of hepatitis A. Hepatitis A it's a viral infection. It inflames your liver. It's mainly caused by drinking contaminated water and having contaminated food. And the main treatment for this is you rest, you drink clean water, you wash your hands, you isolate yourself, and have nutritious food. But the people of Gaza, they can't afford that. There's no rest. There's constant drones in the night. There's constant bombing. They've been displaced multiple times, and ever since we've come back, they've been displaced from Rafah now to Khan Yunis. So there's no rest. They are on the move all the time. They're drinking contaminated water, so they don't have nutritious food. We spoke to people who were having one meal a day, one canned meal a day. So there was no rest for them. And sadly, we'd see kids dying of hepatitis A, 9-year-olds, 10-year-olds dying of hepatitis A. And managing these patients was an absolute challenge. So yeah, we gave antibiotics to people with respiratory infections. But to tell people who had gastroinfections to drink clean drinking water, to wash your hands, to eat nutritious food, I mean, it was simply not possible. And very sad to see such difficulties people are in.
That's terrible. And what about your experience at the nutrition center? Can you tell me about that?
So the nutrition center was right next to the primary health center, where all they did was they saw malnourished children. So this was again in a place called Tal al-Sultan, which is in the heart of Rafah. So in the nutritional center, you get a bit of background again, 1 in every 10 children in Rafah are malnourished. And 1 in 3 children in the north of Gaza are malnourished. And because of the malnourishment, malnutrition, they're getting infections, they're getting skin infections, they're getting respiratory infections, they get gut infections. And when these kids get infected, they don't have the reserve to fight off these infections. So they get more sick, they get more dehydrated, they don't have an appetite, so they can't eat. So that's a vicious cycle. And why was this happening? We saw hundreds and hundreds of trucks loaded with food 400 meters away, not being let in. And on the other side, we are seeing children starving. We are seeing women starving. So pregnant women here would get the best of treatment. You have multivitamins, you have, the best of care. But compared to a pregnant lady in Gaza, she has no food to eat. She's relying on 1 canned meal a day, if that. And she's herself malnourished, and she's giving birth to low birth weight babies. And we have turned our backs on them. Now, people were living in very close, compact spaces, and women didn't feel comfortable in breastfeeding. There was no privacy for them. So they were relying on formulas or baby food, which was not available. And if it was available, they couldn't afford it. The most gut-wrenching thing for me was when a father would come into the nutrition center and say, my child has not eaten for a few days. Is there any milk here? Is there any formula here? As a father, and I asked the fathers in this room, how would we feel to put our children to bed hungry? And this is not one day. This is months and months, 9 months for God's sake, and there's no end in sight. And you ask yourself, what have the people of Gaza done to deserve this? And why has it taken so long, or it's still not taken? I mean, we have not let the food trucks in. And we are seeing food rotting in the trucks. There was some social media post floating around to say the refrigerated trucks waiting outside had the meat gone off. Why are we doing this? Why have we turned our backs on the people of Gaza? There's food there, but there's food not going in. Kids are starving, people are starving, women are starving. It's really gut-wrenching.
And you've actually prepared some photos and video of some of the malnutrition cases that you saw. Could we please play that now?
How old is the baby?
4 months.
Huh?
4 months.
4 months? So look, she obviously she looks quite small. So you check the fontanelle, make sure the fontanelle is okay.
She's 4 months here.
I remember when we first spoke after you came back, you were saying that one of the babies in the photos just then in the ICU container is the smallest baby that you've ever seen during your time as a doctor.
550 grams child weight. It was preterm, delivered by a lady who was, again, malnourished.
That's awful. Moving on to your last day at the PHC, I understand that there was an incident that happened that day. Can you tell me about the incident?
So that was a Sunday afternoon. That was my last day at the PHC, Primary Health Center. So we were seeing patients. It was a busy clinic. Around 4 o'clock-ish, we could hear a couple of missiles fly very close to where we were. And within a few seconds, there was this huge bang. And our center, which we were in, got hit by a shrapnel. It was a pretty large shrapnel which landed, it tore through the roof of the primary health center and landed right across where our consultation room was. There was big commotion. The first response, the first advice I got was, stay where you are, don't go anywhere. As a doctor, as a human being, my first response was, that's not what I'm going to do. So I went out there, in the corridor, there was commotion, people running everywhere. My first response was, is anybody hurt here? And thankfully, there was no one injured. Just then, we saw a man carrying a 3 or 4-year-old child in shock. This kid did not cry. This kid did not blink an eyelid. He had opened up his right elbow. So went to this child, took him to the room, the treatment room. So we were wrapping his wound up. Another local doctor was putting a cannula in. This child did not move. He did not move his hand when the cannula went in. There was no crying and horn. This child was in absolute shock. Just when we were attending to him, I got my second call. You need to leave now. So in the WHO meeting, the briefing which we had in Cairo, there were specific instructions given to us. Instructions where if we ask you to leave, you leave. If you are a surgeon, you're in the middle of performing surgery, even if that means the patient on the table is going to die, you leave. You carry your run bag, you leave. And when I got my second call, I couldn't comprehend that. For a doctor, leaving your patient midway through treatment, walking away, I don't think any one of us can fathom doing that. It's not natural for us to do it, but I was forced to leave. There were more imminent attacks in Tal Sultan that afternoon, that evening, so I was asked to leave. And there was a huge element of guilt. Guilt where I was leaving a patient. I was leaving a young child. I had the license to leave, but the people there did not have the license to leave. Why? What made me so special? By chance, I was born in Australia and not in Gaza. How would I feel if that was my 3-year-old in the treatment room with an open elbow? Would I leave the child? Would I leave the child? And as a father, if I had taken my child there for treatment and the doctor walked away, what would I feel as a father? It was crazy. For me, I still have goosebumps when I remember the day. It was not because of the shrapnel, but because I left a child, and that guilt, I think I want to carry for the rest of my life. It is something which I guess you just can't comprehend doing. I never had comprehended in my time of 30 years as a doctor that I was going to do that. Leave a sick patient and just walk away for fearing my own safety.
And did you get any prior warning of that attack?
No, it just happened out of nowhere. And that was the norm. There was no, you'd be lucky if you got a warning, but while the 2 weeks we were there, I don't recall a single incident where we were told that there was going to be bombing. There were bombs going off, 15, 16, 20 bombs going off every day. Some pretty close to us, some at a distance. And distance, Rafah from Dar al-Bala, where this mid-half where Sanjay was, is a 15-minute drive. And it was not that far. So every bomb that went off, the houses in Rafah would shake. And they can be loud, they can be pretty powerful. And some of the bombs which went off, you could feel your ears pop, you could feel being sucked out of the room. You could feel the force in which the bombs were going. And we were kilometers away.
Did you ever fear for your life?
So when we left Sydney to Gaza, we knew we were going into a war zone. And I, heart and heart, knew there was a very good chance I won't come back. So when I spoke to my parents, I spoke with the intention that was my last call. When I hugged my wife and children, I hugged them with the intention I was not going to hug them again. But as a person of faith, as a person of belief, my thought process was, if it's meant to happen, it's going to happen. If I'm in Sydney, I'm in Gaza, doesn't matter. My time is up, my time is up. I also believe that I was chosen for this. And if God has chosen me for this job, He's going to look after me and my family. So was I scared at any point of time? No, I wasn't scared. I was at peace with myself.
Why did you ask me to come along then?
I needed company.
Now, after the incident, you went back to the safe house, and I understand that the entire team actually all regrouped at the safe house later that evening. And Siraj, you were then transferred to Al-Aqsa Hospital, which is the hospital that Sanjay had been working at from day one. On your way to Al-Aqsa after the debrief, you both travelled through Khan Yunis. Sanjay, can you tell me about Khan Yunis?
So, to give some perspective, Khan Yunis is the second biggest city in Gaza, and it has roughly about 800,000 people. Parramatta has about 250,000 people. So if you can imagine a city 3 times the size of Parramatta, that's what Khan Yunis was. Now, we drove through there to get to Al-Aqsa, and the entire place is decimated. Every building is destroyed.
you see places where people used to live and where they had their homes, and now they're living in tents without any belongings, without any toilets, where they don't have showers, and it's just very upsetting to see that they had this, at least the safety of their own home at some stage, and all of this has been taken away from them. So although we hear the argument that these are targeted attacks on people, it doesn't appear that way when every building has been completely demolished.
And you've actually prepared a video showing what you and Siraj saw. Could we please play that?
So this is the devastation of what Khan Yunis has gone through.
They're covered in bullets. It's terrible.
The WHO is saying that there's still about 10,000 people probably buried under the rubble here.
10,000 buried?
That's what they're estimating.
I just wanted to say, for those who couldn't hear the final comment at the end, that was one of the doctors, I believe, saying that the WHO estimates that there's 10,000 people buried under the rubble. And Siraj, you mentioned that the people of Rafah, some of them are now going to Khan Yunis because Rafah is not safe.
That's right. So we've come back now. It's been almost a month since we've come back. I've kept in touch with the doctors I was working with, the medical students I was working with there. They've all been displaced now. Most of them have been displaced now from Rafah to Khan Yunis, and they are living there. I don't know how they are living. So one of the dental students was my translator at the PHC. She sent me a video where they were drinking seawater. So they were filling up their containers with seawater, and they had a bed of stones and a cloth, and they're passing the seawater through this to sift some salt, so it was drinkable. And they were running out of food, so they were eating one meal a day. And I guess the situation, I can just imagine the situation there was bad while we are there. Now there's no food aid, there's no water, they're resorting to drinking seawater. God knows what's next for the people of Gaza.
That's horrible. Now we're just going to have a quick 10-minute break because the next section does include graphic medical images and descriptions of children and images of deceased people, which might be distressing for some people here. So if you would like to leave or take your child out of the room for a break, please do so now, and we'll just pause the interview for 10 minutes.